What's the best way to manage your attacks? We're about to run through some tips. So if you're looking for a bit more help with your migraines, then this video is for you. Hi, I'm Holly from MigraineSavvy.com. I release a ton of content to help you get better results with your migraines faster. If you're new here, then make sure you click the subscribe button, and all the links to everything I mention in this video are in the description box below. So let's jump right into it. And while we're running through it, make sure you jump in and share some comments with the community and share your top tips too. We all help each other. Migraine relief tip number 1. Always have hope. Dr. Andrew Charles's opening night talk at the Migraine World Summit shocked and amazed me. Here's what shocked me. The hypothesis of migraine being a vascular disease is wrong. The blood vessels do not dilate during an attack, causing the pain. Here's what amazed me. The good news is, even if nothing is working for you right now, science has led us to a chemical cause of the migraine, and this shows that we can develop more migraine-specific treatments. It raises the possibility of more targeted medicine to abort attacks based on an individual's chemistry. So he leaves us with that message of optimism and hope. This is a great time for anyone living with migraine attacks. You have more help available right now than ever before in history. Migraine relief tip number 2. What takes us from episodic to chronic migraine? Dr. David Dodick at the Migraine World Summit talked about controlling unresponsive chronic migraine. First of all, I felt like crying about 3 times watching his talk, and I wanted to say there's no headache centers here, no integrated clinics, no pain rehab programs, just 25 plus years of suffering with poorly prepared doctors guessing at drugs. What slips us into chronic migraine? So many migraine sufferers start out with episodic migraine and then they progress to chronic attacks. These are some risk factors. Frequency of headache and using acute medications. You should be reassessed if you suffer more than 1 attack a week. Snoring and obstructive sleep apnea or another sleep disorder. Obesity increases the risk by 5-fold. These patients get prescribed diet and exercise. Low-carb diet and exercise have good results. Exercise has been found as effective as some of the prophylactic medication. Anxiety and depression increase the risk of it moving towards chronic by 3 times. Allodynia also increases your risk to become chronic. This means that the central sensitization has increased and it's on its way to becoming chronic, so you must initiate proper treatment as soon as possible. Other chronic pain syndromes, genetics, and the risk factors above. Other comorbid diseases and suboptimal treatment of episodic attacks can increase the risk of migraines becoming chronic. Migraine relief tip number 3. Are your triggers really triggers or are they symptoms? Dr. David Dodick at the Migraine World Summit talked about controlling unresponsive chronic migraine. He talked about how to tell if your triggers are actually triggers or if they're symptoms. It's essential to keep these notes in a diary, whether you had an attack, if it was mild or moderate or severe, how long it lasted, and what you took. That's all the information he needs that informs his decision making and how he's going to treat you. As far as triggers go, a trigger needs to be consistent. 75% of the time it must trigger an attack. You can chase your tail with triggers. His job is to raise our threshold so we can live a little more fully and not be afraid to go outside in the glaring sunlight or have a glass of red wine with dinner, so that we're not chasing imaginary triggers. Proper migraine management will raise your threshold. and not trigger you into attacks so often. And then there's that conversation around what is a trigger? Some triggers are actually the attack already starting in the brain and leading to symptoms within the attack process. Mood swings and food cravings like chocolate can all be part of the process. These frequent symptoms are not triggering. Make the triggers irrelevant just by raising your threshold. You can get access to the Migraine World Summit on the links below this video. Migraine Relief Tip number 4. Know your symptoms. Dr. David Williams says, if it's a trigger, it's a trigger. It just won't change. Just try to avoid your triggers. Having an acute management plan is super important. I've written a detailed step-by-step migraine pain management course for you to use. It's free to enroll. The link's below the video. Know your symptoms. Dr. Williams says to get onto the anti-inflammatories. If that fails, get onto the triptans, and then work out with your doctor what to do if things progress from there. The better you are at knowing your symptoms that precede a migraine, the better you are going to be at treating it. If you're irritated and hungry, which are symptoms before a migraine? Take an anti-inflammatory like Voltaren the night before. Don't wait for the migraine to spread. Stay hydrated. Repeat the anti-inflammatory after 1 or 2 hours. If it's not responding to the hydration and the anti-inflammatory, then take your triptan or your prescribed abortive medication. Take it before you get to the nausea phase, before you need to lie down in a dark room. The tsunami's already spread by that stage. Don't take these for a tension headache, but you must know when it changes into a migraine status. The triptan can often be repeated, so talk to your doctor about this. Check exactly what to do if the first one doesn't work. Most triptans allow for a repeat dose in 24 hours. Migraine relief tip number 5. Natural therapies for migraine. You can't cure the way you are wired, and you shouldn't underestimate the power of healthy lifestyle choices. Maintain routines. The migraine brain loves routine. Be healthy. Think whole food, regular exercise, and quality sleep. Exercise a minimum of 150 minutes of brisk walking each week. So 5 days a week, do 30 minutes. Try restorative therapy like yoga, massage, meditation, tai chi. They won't cure you of migraines, but they will relax you. And eat well. Refined carbohydrates and sugary food are well-known migraine triggers, so eat modest quantities. Eat loads of fresh vegetables. Drink coffee and alcohol in moderation or not at all. And get sensible rest. The recommended number of hours for sleep is 9. 7, 5, or 6 is not enough sleep. You are the number one person in your management team. Family needs to know what you're going through. Your GP needs to be part of the process. Emotional support, and to be the center of treatment going forward, might include a specialist nurse, a pharmacist, a specialist neurologist. Find allied specialists to work together with you in the middle. Consider acupuncture, massage, psychology, psychotherapy, and a personal trainer if getting exercise is a challenge. These things will make a difference. Migraine relief tip number 6. Why painkillers alone don't stop a migraine attack. Migraine is not a pain, it's a chemical change. Painkillers work at the end of the pain pathway. They work on the pain, but the migraine is still going on underneath. The sensitized nerve center is the underlying problem. Pain, no sleep, alcohol, chocolate. Pick whatever trigger you like. Your migraines will start to spread the chemical electrical charge that causes the pain. The nerves that go into the shoulders, head, neck, and scalp, if you get pain or irritation on the face, it will amplify. Migraine is not a headache. Dr. David Williams tells us to take Nurofen or Voltaren, aspirin or Panadol. Migraine is not pain. If you are taking Panadeine Forte, you are treating the pain, you're not treating the migraine. This does not address the issue of the sensitized nerves and the expanding chemical electrical tsunami that spreads out when you have a migraine. Anti-inflammatories can stop the chemical spread. If that fails, then use the triptans to focus on the chemical changes. Triptans are not painkillers, they are chemical stoppers. So if you can first use an anti-inflammatory and then use a triptan to try and stop the chemical spread, you've got a better chance of treating the migraine. Migraine is not a pain, it's a chemical change. Migraine Relief Tip number 7. Features of a migraine, why keep a migraine diary, and what your neurologist needs to know. 4 phases of migraine are prodrome, aura, the migraine headache or pain phase, and the recovery phase called the postdrome. Have a migraine diary. This is super important for a neurologist. These are the features your neurologist will need to know. What time of day does the headache start? How is it emerging? Fast, slow? Watch the prodrome. What symptoms come at the same time? Is it just during the week or on a weekend? Is it after you stop drinking coffee on the weekend? Is it after exercise? If it's every day, is it more intense at a certain time of the day? And when is it more mild? How often are the flare-ups? Do they go from a 3 out of 10 headache to a 7 out of 10 headache? Get tools to manage the worst part of it, and then track responses to the treatments you are on. Keep a migraine diary. Migraine Relief Tip number 8. Educating yourself is essential. Terry Robert was interviewed on the Migraine World Summit. She did an interview called They Don't Get It, Educating Family and Friends on Migraine. She also said migraine is a life sentence, but it's not a death sentence. And knowledge is the best prescription, from former Surgeon General Everett Koop. Education will empower you. Education is as important as our treatments. We will be better equipped to deal with doctors. Research shows that when we are part of the decision-making process, we have better outcomes. Education makes us less frightened and less anxious. If you get a new symptom, for example, hemiplegic, that paralyzes one side of the body, it can be terrifying. Migraine disease steals a great many things from us if we let it. When you're panicking, ask yourself these questions. Okay, stop. Is this the worst migraine I've ever had? Am I having symptoms I've never had before? Do I really need to go to the ER? Or is my migraine making me panic? Remember to pause and exhale slowly for 10 seconds. The trick is in the long exhale. And banish migraine guilt. This disease is not your fault. Work closely with your doctor and healthcare teams to find the right treatment and medications that work for you. All the other things that come with migraines, the social disengagement, the isolation, the anxiety, the depression, etc. Through education, you'll gain more understanding to help you make more informed decisions. Be a kind and gentle teacher to yourself. And remember to click the subscribe button so that you never miss out on any of my tips and information that will help guide you along the way. Take care, and I'll see you soon.